and welcome to our call to action webinar, which is really to raise awareness of the opportunity and really the need to help preserve school vision screening funds here in the state of Oregon. Of course, it's always important to put things in context, so we are going to take a moment just to give you a little bit of background. And Brenda, why don't you go ahead and move to the next slide. Oh, our panelists, really pleased to introduce to you Danelle Romaine from Romaine Freeze, who's going to give you an overview of the looming budget cuts that the state of Oregon are looking at in the current situation that we found ourselves in. And Brad, I've got an image of you in a moment. I'm going to introduce you here in just a moment also. My name is Doug Thompson. I'm the Executive Director of the Oregon Lions Sight and Hearing Foundation. I'm going to kind of walk you through really briefly here a little bit of background in terms of advocacy for school vision screening in the state of Oregon. This is an image that we took in 2017. It's a bunch of lions and children's vision health advocates. I believe this was taken in the Capitol Rotunda right after a meeting of the Ways and Means Education Subcommittee. And Brenda, go ahead and move to the next one. We are feeling pretty good about ourselves there because we had a very successful hearing in terms of moving along a bill that would provide funding for vision screening. Brad, there you are. There's Brad King, who's with us as one of our panelists. And in this image, he's showing off the technology that we use, which is a no-touch computerized camera. We call it the SPOT device. And he's showing it to Senator Betsy Johnson there in the halls of the Capitol. Again, I think that was in 2017. I could be wrong about that. We'll go along to the next image. So this actually was February 14th, 2017, when we testified before the Senate Education Committee on the importance of funding a mandate that was created in 2013, which requires families to have documentation of a vision screening or an eye exam for children once they turn age 7. And we did have people testifying in support of the bill, young and old. Young, little Ella there on the right, who did a fantastic job. And I'll say me, old, because Paul Lindman, who's a very good friend of ours, I don't want to call him old in front of everybody here. Moving along to the next image. The nice thing about our advocacy effort is that this was not a controversial issue. House of Representatives, the Oregon Senate, Republican, Democrat, these bills passed unanimously out of committee. They passed unanimously in the House, unanimously in the Senate. There was no contention. It was just a matter of whether or not the funding could be available. And here, actually, this was taken just about a year ago in 2019. Again, Senator Betsy Johnson, who, by the way, is an honorary Lions Club member, big supporter of student vision screening in Oregon. And she's kind of explaining the process to the Lions that attended Lions Day at the Capitol in 2019 in terms of the route, the journey that our bill in 2019 was going to take, that sustained the fund that we created in 2017. And it turned out we ended up doubling the fund. It's a $2 million fund for the biennium, so about $1 million a year. The Department of Education does utilize a little bit of it off of the top for administrative purposes to actually cut checks to schools that get reimbursed for their actual cost of having somebody like us come in and identify critical vision issues. Let's go ahead and go to the next slide, please. So, well, most of the issues that we're finding are like nearsightedness, farsightedness, important issues to find, and we are catching some critical issues. I had Brenda include this photo because this is Ian. Ian's mom is an intensive care nurse, and she told us that when we identified Ian's juvenile idiopathic arthritis, that he was early enough in the disease process where his vision was actually saved through a number of surgeries that he had done. So it's critically important that kids have eyeglasses and that they read at grade level and that type of thing. But this program is also literally saving kids' sight. So I wanted to include that really quickly as we move on to the next slide. So here's our celebratory ceremonial bill signing that we had in 2017, and Lions and again, children's vision health advocates were very, very critical to the process of getting this fund established. We are now able to screen roughly 200,000 kids. And let's go ahead and go to the next slide. We'll get into the nuts and bolts of this. So again, since 2013, the Oregon legislature has mandated and funded vision screening in Oregon schools. And here's why. Most of us understand that learning is 80% visual. If kids don't see well, it's hard for them to maintain progress in school. It's hard for them to read at grade level. And there's a study that we cite quite often that children that don't read at a third grade level in the third grade are 13 times less likely to graduate from high school. There's also a study that our good friend Dr. J.P. Lowry at Pacific University is conducting with our vision screening results in Salem Kaiser schools, connecting children that fail vision screenings to the fact that they are performing 10 points lower in standardized math and English scores. That's a preliminary finding. He's going to be publishing his study here very, very soon. It's something that we want to share with the leaders of the state so that they understand the importance of this program. Ultimately, though, here it is, that last bullet point. We want to help Oregon increase their high school graduation rate. So moving on to the next slide. This coming school year, we have already heard from 500 schools around the state that want us to come in and schedule vision screenings. Boy, the schools love us. Boy, do they love Brad and the other vision screeners that we have around the state that are very efficiently and effectively identifying children that should get a comprehensive eye exam. We've scheduled right now enough schools to do roughly 200,000 students. We anticipate over 600 schools requesting to schedule an event. And as a result, with a referral rate just a hair under 11%, we will, we believe, be referring over 20,000 Oregon children for comprehensive eye exams. And Brenda, let's go ahead and go on to the next slide. It gives me an opportunity to introduce our first panelist, Danelle, who's going to talk about these pending budget cuts. We did hear last Tuesday from the Department of Education that they very likely are going to have to reduce their budget, and this program, school vision screening, could be one of the items. And Danelle, I'm going to go ahead and just have you take it from here and talk about the issue that is in front of us and the reason why we're having this webinar.
Thank you, Doug. And unfortunately, I'm charged with kind of delivering the gloom and doom news today, but hopefully it will allow us to really get on top of this and turn the corner from where we are right now. We've been very successful legislatively, as Doug talked about. Really, the Lions have been since 2013. And unfortunately, because of what's happening now with the coronavirus, our state revenues, which come in really from personal income taxes, from corporate income taxes, from capital gains taxes, are way down. And in anticipation of yesterday's state revenue forecast by the state economist, the governor asked all state agencies who currently receive these general fund dollars to start preparing proposed budget cuts, assuming that state revenues are significantly down because of what's happening to our economy right now because of the coronavirus. And yesterday, during the revenue forecast, the state economists confirmed that for the current 2019-2021 biennium, the state is anticipated to have already lost about $3 billion in revenues. That's about a 10 to 15% hit to the general fund budget already. The state has to have a balanced budget. The governor has limited tools in her authority on how she can balance that budget. And the only thing the governor can do is require across-the-board cuts at state agencies. And so in response to her directive, state agencies, including the Oregon Department of Education, released last week their proposed budget cuts and really, unfortunately, completely proposed to cut the school vision screening program for the upcoming school year. They also proposed cuts to other programs, including a couple weeks of the school year, cuts to teachers, cuts to other programs, but they did propose to cut our program, and the reason that they gave in their documents is that they did not believe that the vision screenings could meet current requirements for social distancing and public health and safety in terms of personal protective equipment and so on. And I think we're going to show that that's just incorrect, and that we need to get the message out now that we can absolutely operate school vision screenings under the current environment. Doug?
Yeah, Brenda, can you hear me okay? Because it looks like my screen is frozen, but as long as you can hear me, I'm going to go ahead and keep going.
Hear you.
So,
we sure can. We can hear you.
excellent. Okay, so let's go ahead and go to, thanks to Nell. Let's go ahead and go to the next slide, and we'll give you an overview of how we are in the process of modifying our methodology of conducting school vision screening. But I just want to emphasize a couple of things. One, our first priority in this modification, of course, is to keep students, school personnel, and our own staff safe. And we're going to give you an overview of how we're going to do that. As we talk also about the communication to legislators and to the Department of Education, I just want to emphasize that this is not a contentious issue. I think there is just a really understandable misperception because the spot device is designed to be 3 feet away from the student. And our intent is to keep the spot device 3 feet away, but our staff members will be a minimum of 6 feet away. We're absolutely going to adhere to social distancing and to whatever new ODE guidelines are created to pertaining to adult volunteers visiting schools. So now I'm really pleased to be able to introduce to you Brad King, who's going to walk us through the process of how we're going to do this. And Brad, I always enjoy bragging about you. During the recently completed school year, here it is May, and we're talking about a completed school year, but let's say cumulatively, we screened around 180,000 kids. Brad, who you see on the screen here, screened 37,000 plus of these Oregon students just by himself. He referred 4,700 students for comprehensive eye exams. Brad has been doing this for a number of years, and he's very, very qualified to talk to you about how we can take our process and adhere to social distancing. So Brad, why don't you go ahead and take it away?
Thanks, Doug. I didn't personally screen that many kids. I had hundreds and hundreds of volunteers, Lions Club members, moms and dads, high school students, whoever we could wrangle into it, actually do the screenings. And Grandpa gave me two good things, those bright blue eyes and that fast-growing beard. I don't look like that anymore, obviously. So as far as our adaptations to make school screenings safe and compliant with social distancing, we met Monday morning here and kind of fabbed up how it would go. And for starters, you'll see me there wearing personal protective equipment. I've got my face mask on and my safety glasses. And as I would approach the school, I would take my own temperature, do my own personal screening. Here you see one of the nice nurses from Legacy Systems taking my temperature and giving me my screening. The simple fact of the matter is, if our staff members don't feel well on that day, they're displaying any symptoms of anything, we make a call to the school and say, we're really sorry, we can't come in today, this is what's up, and we'll have to reschedule, because we want to keep those students and the staff safe. So again, we do a temperature screening and make sure that everything was all good with us initially. So Monday morning, we called Central Casting and asked for a first grader, and we got the lovely and talented Ella Asbra and her little sister Ruby Asbra, one of our staff members' kiddos, got geared up and came in. Ella even put on her backpack for us. And what you see here is kind of a quick fab up, a Rube Goldberg setup of how we can adapt our school vision screenings to comply with that minimum 6-foot social distancing. You'll see Ella over there on the left of your screen, the little girl in pink, and the big ugly guy on the right is me, again in PPE. And that distance is actually more than 12 feet. We fudged and put in a little extra. So she's standing on, pardon me, a blue mark on the floor there, 6 feet away from that chair in the very middle, and I'm standing on a blue mark on the other end, holding our AV cart with the spot screener stuck up on the front of it. And you'll see a chair there in the middle. So to conduct our screenings with appropriate distance, our kiddos would stay that far away at the beginning, lining up to come into our screening. And I'd ask that kiddo to please take their sticker that has their Lions ID number, that super secret anonymizing number that keeps their identity protected and keeps us compliant with FERPA and HIPAA, those personal identity laws. Ask her to put that on that paper on that chair. She steps up and does that, And then I'd ask her to please step back on the X that she was standing on. And then I would get that piece of paper with her sticker and her Lions ID number and step back behind the spot, behind the cart that we're using, whatever it is that we're going to use, something similar to this. And I'd input that data into the spot. Now, school districts trust us like crazy, and they give us all their sensitive student data, knowing that we protect it jealously. And I put that number in there, and it would populate with the student's information, their first name, their last name, their age, that type of thing. And so the next thing I would do is just to make sure I have the right kiddo, because sometimes they switch stickers on the way in, ask, hey kiddo, what's your name? And she told me Ella. And then I hit the start button, and then I would push my cart towards her until we're about 3 feet away, and I've got a good focal point. I can see her face right in the middle, her eyes are right in the center. And this time when I did Ella, I captured her vision screening in about 3.5 seconds. And that's as far away as I was. You see my toes there on that line. We doubled down on 6 feet. We added a little bit more in. I'm lucky. I have really long arms, but as you saw, I didn't even have to come to full extension to get the spot within 3 feet to capture Ella's vision. We did it with Ella. We did it with Ruby. We're thinking about other adaptations to put maybe a tripod on a cart to give us left and right and up and down pan so that we can conveniently get kindergartners to seniors in high school, little 3.5 footers and big 6.5 footers, and that it would be easily adaptable for use by anybody on our staff or any high school students, school staff members, or community volunteers if they're allowed into schools. Anybody from about 5 feet tall to well over 6'4", that's me, could use this comfortably. Doug, anything else?
I think you covered that pretty well. Because the thing that's going through my mind is that, we realize that we're not NASA and we're not creating some type of a high-tech extension process. That being said, though, what you're seeing there is, just a very basic example of how we can extend the 3 feet to 6 feet. And once we're able to, I'm knocking on wood right now, once we're able to preserve this fund, then over the course of June and July, we will acquire the equipment to make a really effective and efficient process that can be replicated in all of these 600 schools across the state. So we're very open to your suggestions in terms of how we can make this extended screening process effective and efficient. So feel free to either, you can make your suggestions during this webinar, or of course you can email us or give us a phone call with the suggestions that you have. Now, in order to preserve that fund, Brad, thank you very much. You're an excellent actor in terms of the process of creating that video. Oh, I do want to say that the still images, again, we have a video. It's about 1.5 minutes is all. And we are going to be sharing it with legislators, with our friends at the Department of Education, with all advocates that we have. You'll receive that video today since you participated in the webinar, and you'll be able to see, in actual live action, how we're doing this. We're now going to talk a little bit about the actual call to action and what you and other Oregonians can do to reach out to your legislators and the Department of Education to ask that this fund be preserved. So Danelle, if it's okay, I'm going to bring it back to you, with the statement that, again, we're not angry at anybody. We're not upset that anybody has done anything. We think that there's just a real simple, I'll call it a misunderstanding in terms of the distance that is required between the student and the vision screener to make this program work. We realize that budget cuts are a reality, but our intent is to communicate that let's not cut this funding because it doesn't adhere to social distancing. And Danelle, if it's okay, I'm going to bring it back to you, and if you can walk us through what you are recommending that we say to our state legislators and to the Department of Education.
Yeah, thanks, Doug. I think it's been clear from the many years we've been doing this at the legislature and with the governor that there is widespread bipartisan support for this program. As you said, the bills over the past 4 years have passed unanimously through the legislature. So this program is well understood and loved, and the budget cuts are just proposed at this point. They are not finalized. So here's what we need to do, and it's up on your screen. We need to contact all of our friends who understand the value of this program, including your local legislators and Director Colt Gill, who's the director of the Department of Education, and say, look, we understand why you might have thought we couldn't do this under the current environment. That's actually not the case. We've been able to modify the program to meet all current social distancing and safety measures. This program is absolutely vital to children. We need to ensure that this continues for the upcoming school year. So as Doug said, you're going to receive this draft email to send to your legislators. I know the Lions have made it very easy, and I think we're going to walk you through how to find your legislator, their email address if you don't know how to do that already. We're going to give you the email address for Director Gill and for the governor's office. And the more advocates we can get delivering this message that vision screenings need to continue for the next school year, the better. You are your best advocate to talk to your local legislator, and we're asking you to do that today.
And Danelle, I think it's fair to say that, at least from our experience, that legislators appreciate not only hearing from their constituents, but they really appreciate hearing from Lions. I realize that not everybody participating right now is a Lions Club member, but for those that are, the work that you do in your communities is recognized, it's respected, and it is so much appreciated by our elected officials. We really enjoyed the Lions Day at the Capitol experience. And Brenda, why don't you go ahead and go to the next slide? We'll give you some examples of some of our state elected officials that are aware of this program and genuinely love what we're doing. This is Wally Anderson, who has been a part of our staff for about 2 decades. And he is one of our rock stars that travels around different parts of the state doing the screenings. Here he's showing Representative Jeff Barker the technology that we use. And I happen to have attended that event, and man, Representative Barker could not talk enough about the efficiency. He was literally blown away by how quickly these classrooms were coming in and out, and how accurately this technology works. In fact, he basically said, hey, I want to sit down and use this. And so he actually volunteered for a while during this day at a Beaverton elementary school. I think Kinnaman Elementary is where this image was taken. And Brenda, why don't you go ahead and go to the next slide? And this is Representative Warner Reschke, I believe, down the Klamath Falls area. Representative Reschke's on the right. To his left is another one of our staff members, Stephen Brewster of the Klamath Falls Lions Club. These are some nursing students that were actually made available to help use the technology on that particular day. And again, these are just 2 images, the representative of the support that we have for this program. If we had more time, boy, we would show you pictures of legislators that have enjoyed seeing in action this technology and the Lions vision screening in literally every part of Oregon. So as I know that sometimes there's a little trepidation in terms of the concept of contacting my legislator. Please know that they're going to appreciate hearing from you. There's just no controversy over this at all. This is Mr. Colt Gill, who we have mentioned a couple of times. He's the director of the Oregon Department of Education. And this is an image from January when he dropped by Liberty Elementary School in Salem. And that's Brad showing him how to use the technology there. And Colt made a comment at the end of the screening saying, man, you know, I really enjoyed this, and as a past principal and a past superintendent, I'm aware of the work that Lions do, but I had not seen this technology before. And he told us that, boy, as I was seeing these results, I just knew that these kids that were being referred, they're going to go to the eye doctor, they're going to get eyeglasses, and they're going to be on the path to success academically. So as you contact Mr. Gill, I understand that he supports this program. And I think that if he has his way, I think we all will agree that, boy, we'll preserve this funding if at all possible. Again, you know, there just may be some difficult decisions that have to be made, but your communication to Colt Gill will be very helpful in him understanding that, yes, we can adhere to social distancing. and still take accurate images of children's eyes. For those that aren't aware of that device there that Colt is handling, I know we've mentioned it a little bit, but it captures a 360-degree image of the student's eye and can identify, I think it's up to 8, 9, 10, maybe even 11 different vision health image or issues, and then can very accurately refer children for comprehensive eye exams. That's the bottom line here. We know that this is just screening. The key is getting kids to the eye doctor, kids that need them, getting comprehensive eye exams, and identifying issues that, again, if we can address them, we can help them be successful academically. Brenda, why don't you go ahead and go to the next slide? And I think we're going to open it up for questions, and then I think the next slide also, or Brenda, I think at this point, are you going to walk folks through how they can find their legislator?
We are. So I wanted to go ahead and point out what we have on the screen there. We've got several links, and we will send these out to you. And I'm going to go ahead and click on the link there, and I'm going to bring up our Find Your Legislator. I can't talk today at this point. So I'm going to bring that up and show you how to do that. And as we're doing that, the other thing I wanted to point out is that your foundation does have a YouTube channel. And that YouTube channel allows for you to see all of the video productions that we've put together on our in various productions. Okay, I'm going to move this over. And as you can see on your screen now, this is kind of the map of Oregon. You can see the various different districts and items that are on there. And what we've got is that area up in the upper right-hand corner where you can type in an address. Sorry for the typing sound, but and you can click that button, Find Who Represents Me, and that will take you to your district representatives. And you can click on Senate or House representatives there in order to find out who and how to contact those individuals. One of the questions that we received was how to get our representatives to respond. Is there any particular way, Danelle, for us to communicate with them so that they are more likely to respond to us?
Yeah, email, I think, is the most effective way to reach people right now. Everybody is checking email. Everyone's home, just like you. I found legislators to be very responsive. Their staff is still working remotely and checking their email. So I think, you know, unless you know somebody personally and have a phone number for them, I still think email is the best way to reach them with your messages.
Thank you. One of the other questions that we had was about volunteers, and I'm wondering, Doug or Brad, if one of you could address what might be happening with volunteers this fall.
Sure, I'm happy to do so. I may actually lean on Danelle and Brad for that matter. Yes, it's a really good question, and I appreciate it being asked because really there are two, my understanding is that there are two primary concerns that the Department of Education has about vision screening. And one of them, of course, we've talked about, the social distancing issue. There appears to also be a concern about adult volunteers. Mentioned that Colt Gill attended an event at Liberty Elementary School in Salem, and of course he saw that we had Lions Club members that were there primarily during that event. Brad, correct me if I'm wrong, I think primarily they were kind of herding students and greeting them and getting them in line. They did a wonderful job. They were South Salem Lions Club members. I think we had Sprague High School students in attendance, actually holding the spots and utilizing them under Brad's direction. So the concern is, in addition to the social distancing, the use of outside adult volunteers. And we believe that it's very, very possible that new guidelines in place for this coming school year in adherence to social distancing may limit or not allow any adult volunteers coming into the schools. We don't know that for a fact, but we think that there's that possibility. So we believe that we possibly will be asked that if we have the opportunity to continue doing vision screening, that we do so without the use of adult volunteers. So it's really little bit too premature to talk too concretely about that, but that's our understanding that that could happen. And Danelle or Brad, actually, let's go Danelle first, and then Brad, if you have anything to add. Danelle, can you also address that?
Yeah, I think you're exactly right. Just like everything else in our society right now, everyone is trying to adapt to this new reality very quickly, and so is the Department of Education. And it is their goal to try and reopen public schools in some fashion for the upcoming school year. They are currently working on those guidelines. We don't know what's in them. We are going to let you know as soon as we know what's in those guidelines. And then, as you've already seen through the videos and the pictures of the videos that Brad walked you through, we're going to adapt this program so that it meets whatever the new guidelines are for both social distancing and for personal protective equipment and for who can and cannot enter a school building during the upcoming year. So we need to be flexible there so that our program is adaptable when those guidelines are finally released, and that's what we're working on.
Thanks, Danelle. I appreciate that. And then, Brad, if you would, I'd like you to perhaps give your insight in terms of, well, gosh, is it even possible to conduct these events without the use of additional volunteers? And if so, what might that look like? How long is it going to take to screen a school of, say, 400 students?
Without the use of at least a good handful of volunteers, it's going to take longer. It's going to be a much longer day with just staff members and maybe a school staffer or two doing the screenings. We're very fortunate in a lot of places to have high school students that can help us. And we have a really great cadre of school nurses all over Oregon who are always willing to pitch in and help. It's going to be tough because Lions want to help. They want to be of service in their communities. Had that experience with my 90-year-old dad yesterday. And we understand that, but as Lions, we also need to understand that our objective is to get these kids vision screened so they can do better in school, get the vision help that they need, and however that happens, that's going to happen. So we will adapt, we'll overcome, we'll improvise, we'll make it work.
Thanks, Brad. We also know that schools are in the process, school districts are in the process right now of trying to figure out what school is going to look like if they open in the fall. We heard yesterday that, for example, the Tiger Tualatin schools are looking at a classroom situation. I'm going to probably just read this off of the email that we received. That they're looking at a hybrid method of learning where kids would rotate in small cohorts at school and then would also be doing distance learning. So what our screening may look like if we're able to go into the schools could look significantly different than what we're accustomed to. Our methodology, we believe, will work. It's just that if there's only 1/3 of the number of students in the school at a particular time, then of course it's going to take maybe 2 or 3 visits to that school to capture results for every student. So again, it's premature for us to know exactly what it's going to look like. We just need to be prepared that it might look extremely different than what a traditional school day has looked like in the past. Brenda, are there any other questions that we have from the audience at this point?
We have quite a few questions, actually. I'm trying to keep up with all of them. So one of the ones that we just received was, can other school district employees and other, because it sounds like only high school students and other volunteers might be able to come in and help, and we might have some, we might have to recruit from within the school or from those high school students rather than from within Lions. And that was a comment there. And then Mike Malter asked, should we copy or BCC anybody, such as you, Doug, or anybody else on the emails that they're sending?
I'm going to let Danelle answer that question, yet I will mention that we appreciate being CC'd on there's been a number of emails already going to state legislators, and it's nice to be CC'd on them, but it certainly isn't required. But the responses from legislators have been extremely supportive to this point. Danelle, can you go answer the question better than I can?
Yeah, I think you can absolutely CC. I think you can email your legislator directly and Director Gill directly. And when you get a response, I think it's important for Doug and others to know so that we can follow up with people. But I don't think you have to worry about CCing everybody on the initial email. But we do want to know what the responses are so that we can follow up and give people some information as we kind of update our procedures.
Danelle, would it also be okay, and even if it's just a little bit redundant, also speak to, what might happen in terms of a special session, how is a budget going to be approved? What's in a nutshell, what's the process of that look like over the course of the next few days to a month or so?
Yeah, so the revenue forecast happened just yesterday, and I explained that the governor has very limited tools in her toolbox. All she can do is across the board cuts. The legislature, on the other hand, can go in and say, okay, here's the number we have to get to. We're not going to make any cuts to this administrative agency, for example, and we're going to make a lot of cuts over here, or we're going to use these budget reserves. We're going to do other things. So they have a lot more tools in their toolbox. Whether or not the Oregon legislature meets for a special session where the governor calls them in to do just that remains to be seen. And I think we're looking at late June or sometime later this summer before they actually meet. Now, what might happen is the governor could say, for example, I'm going to make these across the board cuts unless the legislature comes in for a special session and does something different. So we could see something like that happen. But right now, really, we don't know when the legislature will meet.
Thank you. Appreciate that, Janelle. Brenda, other questions that we have?
Yes. Will we be able to supply enough tripods and carts to accomplish the screenings per school?
Yeah, it's another really good question. And what will happen in the event that this fund is preserved is that, as we mentioned previously, our school screenings will take longer. And you know what? That's perfectly okay. Since they will take longer, though, the expenses for us may go up. And of course, acquiring equipment will be one part of that. So we very likely will be reaching out to the private sector, foundations, businesses that are able, and individuals. We will do some additional fundraising to subsidize the public funds that, knocking on wood, will still be available so that we can continue to identify students that need to have a comprehensive eye exam. So the reality is, it's interesting that this fund that we helped create that now is managed by the Department of Education is based upon a budget of ours from about 5 years ago, because the bill was passed into law back in 2017, but it was based upon 2015-16 financials that we were asked to provide to the Legislative Fiscal Office. So it's interesting, this reimbursement rate that schools get at $3.20 per student has changed over time. So the reality is, even if we preserve this fund, we will probably have to do some additional fundraising to be able to offset our expenses. And you know what? We're happy to do that. We have established as part of our mission to screen as many Oregon students as we possibly can. In fact, we have what we call our 2020 vision, that one day, there was a time that we thought it was going to happen maybe in 2020 or 2021, that every child in Oregon would have their vision screened. We didn't anticipate a global pandemic coming along, but since it has, that vision may be achieved a little bit later than what we thought. But because we have this vision of one day every child being screened for vision health issues, we'll do whatever it takes to raise the money to acquire the additional equipment that it will take to do so. Excuse me. Great question. Any others, Brenda?
Yes, we have another one. Well, Steve suggests that some of the schools, when they are busing or bringing students back, may limit the number of students, or they may extend their schedule so it's a mix of in school and at home. How might that work to extend our screenings to accommodate that?
Yeah, and again, it's a really important consideration, because we do not know what a typical Oregon school day is going to look like. And as I mentioned earlier, the email that we received regarding the Tigard Tualatin School District apparently looking at, if you want to call it a cohort or a pod. Answer to the question is, we don't know yet. It's very possible that every school district might look a little bit different. So we will have to develop a plan that will adapt to whatever that particular school district is doing. So I hate to dodge a question, but I just really can't answer it right now until we know, excuse me, what those school days are going to look like, and we'll do our best to adapt accordingly. And I'm very open to that. Yeah, go ahead.
Yeah, we do have good open lines of communication with school districts all over Oregon, school officials. We know that we can pivot around, be a little bit nimble, adapt and improvise. And like Doug said, we just don't know. We'll see what happens and we'll make it work.
Yeah, thanks, Brad. I think it's kind of one of those things, hey, we'll cross that bridge when we come to it. The first bridge right now is sustaining the funding, preserving the funding. And then once that is accomplished and we begin to communicate with the different school districts, which is going to be a very large task, because we mentioned we anticipate 600 schools. I don't know exactly how many school districts that is. It's a couple hundred, obviously, right? We would think that most school districts will probably have a fairly uniform school day, but I guess the answer to the question is we will do everything we can to adapt to what a school district is doing. It's also an example of why the program, the expenses will increase, and we'll do what we can to adapt to that. These are great questions, by the way.
And this is from Triva. Triva says, this is not a question, but I would like to comment on the great benefit of the vision screening program. I am a school nurse. In addition to identifying students who may need a full vision screening, full vision screen may be impacting their education, it is also helps fulfill the requirements in the evaluation process for students with potential special needs. A vision and hearing screening is a requirement for all students being evaluated.
Yeah, thanks for that comment, Trina. We love working with the school nurses. Hey, Brad, we have time. Can you share just really quickly the story of in the Beaverton School District where we were asked to come in and demonstrate the technology with some special ed students?
Oh boy, that was a tough day. This was several years ago when we first brought the spots on board. Brenda and I were invited to go and demonstrate at a very special classroom in the Beaverton School District. We had screened in the Beaverton School District with our old Snellen charts, HOTV, and it was a long, hard day. It was confusing. It was kind of messy, and Beaverton wasn't sure they wanted us back. And so we showed up, and they had 9 kiddos there. And they said, we've got about half an hour to get this done. We whipped through 8 of them in just a very short period of time. And this one boy just was full of energy and didn't want to hold still. And we chased him around and around and around that room. And we finally got his vision screened. I don't remember if it was me or Brenda. And we tried everything we can. I have chased kids around gyms for years. And it always works. And it worked with that kiddo in Beaverton, and we've been back screening kids in the Beaverton School District every year, every school. Since then, we have a tremendous relationship with the school nurses in the Beaverton School District, as we do all over the state and every school district.
Yeah, thanks, Brad. By the way, for those that do not know, Brad is a retired cop. And I still remember him describing that experience of chasing that student around, and they said, man, there were some criminals that I used to chase that weren't quite so difficult to catch up to. That student I often refer to as the reason why we screen, I think it's 13,000 students in the Beaverton School District. If I'm wrong about that number, I apologize. But boy, that opened the floodgates for us because, again, now that led to where we're at now in terms of screening in over 600 schools. So, Brad, great job on that. And thanks for sharing that anecdote. Other questions at all, Brenda?
So at this point, I just want to say thank you to a lot of the people in our audience who are making suggestions for the protective equipment or ideas about whether we could use pneumatic tables or there are different types of tripods or setups. And I really, really appreciate getting any and all suggestions. So please, not only will I document these, but as anybody who could send a different information to us, just email us that. The other thing that I wanted to mention is that we have a couple different questions about, kids who are going to be more difficult to screen, and they're wondering if there is a way for volunteers and individuals to come and help. And I just want to let everybody know that we are going to continue to explore every one of these options with the different school districts and with the Department of Education, so that if we are able to go in and screen, that we will be able to have as many helpers as we can in each school, in each district.
Probably important just to reiterate that the issue of adult volunteers helping out really will be a decision not made by us. It's certainly going to be an Oregon Department of Education decision. I suppose it's possible it also could vary school district by school district, but again, we're in a wait and see mode. But as of today, our understanding is that it won't be a decision that the Oregon Lions Sight and Hearing Foundation will make. We will abide by whatever any school district or the Department of Education determines is in the best interest of students. Brenda, since personal protective equipment has been mentioned, a couple of things really quickly, and I know I already said how that AV cart that you saw in the still images is just a prototype. We plan on coming up with something better. Really quickly, Brad and I both brought in these little dolly scooter type props the other day to demonstrate, and then we got looking around the room that we were in, and we saw that cart, and we thought, hey, we use the cart, Ella won't have to sit down and won't have to disinfect the chair every single time. So we are very open to your suggestions and recommendations of what the equipment might be. We just wanted to demonstrate the 6 feet, that we can extend the 3 feet distance. Brenda, can you talk about personal protective equipment and what that might look like for us?
Correct. Yes, at this point, we are looking to have everybody wearing the disposable face mask, so that Brad puts it on there. So we have those, and we're going to have those available for all of our team members as they're going out and to provide to any of our helpers who are able to join us that day. And then we're going to have goggles and eyewear, safety protective glasses. We will possibly have face shields that can be used. Gloves will be available, and we'll use them as that's something for us. And then most importantly, we're also going to have cleaning wipes and other disinfecting capabilities that we're going to use as we handle equipment, and as we hand one spot off to another helper, we might go ahead and clean that, disinfect that, and then of course before an event or after an event, making sure that we're getting everything clean. So we're going to make sure we have everything we need for those purposes. Very
good. And Brad, thank you for modeling the face mask. If anyone's wondering, Danelle somehow inadvertently got cut off. She's trying to reconnect. So if you have a question for her, we may actually just need to do that remotely and send and email you her response. So feel free to still ask her a question. She just somehow got disconnected. Brenda, any other questions before we say goodbye?
I think at that point we've covered most everything. And then anybody who has a question that I've not gotten to or has made a comment, we're going to be responding to those throughout the day. Thank you.
Okay, so in conclusion, if you want to go to that last slide that I think we have, many of you are aware of the role that Helen Keller played in Lions taking on sight and hearing as part of our mission. And the long story short is, it was back in 1925 where Lions were only about 7 years old at the time. And Helen Keller said, hey, be Knights of the Blind, help address preventable blindness and hearing loss. And so this is why Lions Worldwide, and here in Oregon, we like to say we continue to keep that promise that was made to Helen Keller. And our school vision screening program is our flagship program, and probably the best illustration of how we keep that promise. And as she said, one person can make a difference in a person's life significantly, and you can make a difference by contacting your legislator, helping us preserve this fund, and continuing to make it possible for us to keep the promise by addressing vision health issues in Oregon children. So thank you so much for participating today. You can keep the questions coming offline, and of course we're going to respond to you. And again, we're going to send you the PowerPoint, we're going to send you the video, and we will send you a sample letter that you can send to your state legislators and to Colt, Gill, at the Department of Education. And even though we're saying goodbye, welcome back, Danelle. Is there anything else, Danelle, that you'd like to add before we depart?
No, sorry about that. My network connection is not great, but thanks so much for everything you do. And I really think your relationship with your local legislator
So looks like Danelle may have experienced or has experienced another technical difficulty. And with apologies to her, I'll finish her sentence by saying that the communication and the relationship that you have with your state legislators is important. It can make a difference. And so thank you for all of you that have already communicated to your legislators. And thanks in advance for those that continue or that decide to do so. Brad, anything else that you'd like to add?
Same thing. Truly, it's been my experience with my degree in political science that your legislators do want to hear from you. They want to serve their constituents and make that difference in how people's lives are lived here in Oregon. And I can tell you that with your help, we'll continue to do this. We'll continue to screen kids all over Oregon. We'll continue to help them be more successful in their education and in their lives beyond that.
Excellent. Thanks for that. Okay, Brenda, thanks so much for making this work. We appreciate your technical aptitude very much. Brad, thanks for being part of our panel. And Danelle, thanks so much. We really appreciate everything that you do for students here in Oregon, the advocacy work that you have provided to date and into the future. So thanks so much for being part of it. And also, of course, thank you to all of you for joining us today. We had great attendance. Again, continue to ask us questions, share concerns, and thanks for helping us keep the promise and for advocating for children's vision health here in Oregon. Hope everybody has a good day, and we look forward to seeing you and talking to you soon.
Thanks, everyone.
Thank
Have a
you.
great one.